we'll now focus on another issue of concern, and this is regarding vaccines. There are reports of counterfeit versions of Covishield vaccines circulating in the international market. This is a concern that was flagged by the World Health Organization as well, and it pointed out specifically to countries in Africa and then in India as well, where these counterfeit or fake vaccines of Covishield were found that were even checked by the Serum Institute. Now, the centre on Saturday shared a list of parameters to identify the authenticity of COVID vaccines being used. The parameters will help identify whether the vaccine is fake or genuine. And the note that has been sent to states has details on the label, color and other details used by the vaccine manufacturer. Well, let's go back to Dr. Ishwar Gilada for more on this, and tell us how big a concern is this, because there have been reports of these fake vaccine camps that have been held, and it's absolutely shocking and very alarming as well. There was one in Mumbai, then there were some held in Kolkata. Those are being investigated, but no one wants to even imagine that, there are fake vaccines that are being used in parts of the country.
Gargi, all this will depend on demand and supply mismatch. If demand is more, supply is less, all these things will happen. Either countries like America will use power and threat. For example, you remember Trump calling Modi and telling that we need SCQS by anyhow. And first day we said no, second day we had to give in. So that kind of power threat. Secondly, if people cannot use power, lower front countries, they would use any fakeism. So they will take fake vaccine or from black market. We have seen during tocilizumab shortage, remdesivir shortage, a lot of fake were produced. But we don't take action. If we take action, the court cases do not go to court. If they go to court, there is no punishment yet. So I think
Doctor, one would imagine with vaccines, it's very controlled, because we have the CoWIN platform. Everything is supposed to be online. Even when you go to a vaccine center, you're meant to register and, you're supposed to get a message, etc. So given that, it's very surprising. And of course, we hear reports of these small centers in rural parts, of these very small camps being held. And that is where I think the worry is that correct? And while states have been asked to check certain parameters for the vaccine, what can people who are going to a vaccine camp look out for?
You see, people should not go to vaccine camps at all. There are so many vaccine centers. They should go to genuine vaccine centers which are able to give you immediate confirmation, certification, everything. If somebody says you will get tomorrow, that is fake. There is nothing like tomorrow here. And we have seen even among doctors who did not get message earlier, they did not get the certificate also. Secondly, if you don't look at India, because I was very much surprised by the statement of Health Ministry yesterday that we don't want any such kind of fake thing happening in India. That means you should make it happen elsewhere, because currently India is supplying vaccine in many places. Secondly, if you look at, there are 5 countries which are sitting on vaccine. USA, UK, Canada, Japan and entire European Union. They are sitting on 2.1 billion crore, 2.1 billion vaccines. And that is going to expire. So if you, on one hand, you have a full extra supply, 4 times or 3 times more than your population. And on the second hand, on the other hand, the vaccine is not available with COVAX. COVAX is supposed to supply 1.1 billion vaccine in last 6 months. They could do only 1/8 of it. So I think these countries, which are very powerful countries, rather than making vaccines expire, supply them to COVAX and then poorer countries, then they will not do all this kind of fakeism. They will get some vaccine. So it is going to be a human situation where on somebody is getting and other person is not getting. That person want to get it by hook or crook. And there are a lot of crooks in this country.
Right, but clearly states now need to look out and as you said, it needs to be better investigated, any of this black marketing or any sort of fake vaccines that are available.
You see, individual person cannot imagine which is fake or which is genuine. So it is manufacturer's responsibility to make a system robust. It is in their interest also. Suppose a manufacturer has to sell 100 crore vaccine and 50 crore are already fake vaccine, their sale will be hampered by 50 crore. So for them also, it is important to have a robust mechanism. Secondly, if the outlet is one, then it has to be checked how it is going. Suppose vaccine has gone from India to some Asian countries or Africa, how did it go? Whether there has been a check mechanism at the airport, whether they have been checking who is supplier, from where they are buying. So when there is a control mechanism, I don't say manufacturer should be held responsible, but somebody is responsible, and that somebody has to be planned properly. So you must have a think tank.
Proper action needs to be taken.
All this mechanism,
and this needs to be investigated. Well, thank you so much, Dr. Ishwar Gilada, for joining us on the program.